We experience music every day. From the songs we hear when we're on social media, the music playing on TV shows, advertisements and movies, or even the rhythm of a car horn and the melodic underpinnings of a speaking voice, even the beat of our own heart, even a song we have in our own head. Music is all around us. For those that can, many can hear it. For many others, we can feel it. But mostly, we can remember it. Do we know the extent of how our experiences, like how we experience music, shape our communication and our mind? Do we know that same extent for our clients or patients? Everyday activities for an Alzheimer's disease patient become more difficult, and decline in memory is a devastating deficit in the progression of this common type of dementia. There is, however, one heavily documented and proven treatment area that is administered in healthcare as a tool to preserve cognition, communication, memory recall, and enhance the patient's quality of life: music. As speech-language pathologists and speech-language pathologist students, we understand the science and the role sound plays in communication. As a review, our sound center is in the temporal lobe, more specifically the ascending neural pathway to the cochlea and the auditory center, and Heschel's gyrus. Music, however, is not known as a single circuit in the brain, but activates both hemispheres, making music unique from speech and sound on their own. Sound is comprised of pitch, time, intensity, and timbre. Pitch is the perceptual frequency that is picked up in the cochlea of the inner ear. In music, however, pitch is used to construct melodies, which is a pattern or patterns of pitch over time. Chords, more than one pitch presented at the same time, and harmonies, more than one melody line presented at the same time. Time, which includes a beat, a rhythm, and a tempo, or the speed, is perceived in the subcortical structures like the basal ganglia and the lateral cerebellum. Warren J. 2008. Intensity, or dynamics in musical terms, is perceived in the auditory cortex. And timbre, or the quality of sound, like distinguishing a violin from the sound of a human voice, is in the superior temporal lobe. The lateral temporal and parietal lobe link auditory information with information derived from other sensory modalities, like the parietal lobe, and especially vision. Think the occipital lobe. The parietal and frontal lobes have to do with working memory for music and other sounds and behavioral responses to sound. This includes the subcortical structures, more specifically the limbic system. Indeed, music is a whole brain phenomenon, not just in the auditory cortex. There are different perceptual, cognitive, motor, and emotional components with varying selectivity. So how does music affect patients with Alzheimer's disease? In order to explain the musical connection, it is helpful to have knowledge in the behaviors that are displayed in Alzheimer's. Alzheimer's disease is a degenerative neuropathological disease characterized by a progressive decline in cognitive and behavioral functions due to a progressive posterior atrophy, particularly in the medial and temporal lobes. Alzheimer's disease impairs cognition, communication, behavior, mood, and the quality of life of the patient, and additionally adding an increased burden on caregivers. Agitation is a core behavior feature of dementia, which is defined as an inappropriate verbal, vocal, or motor activity that is not judged by an outside observer and results directly from the need or confusion of the agitated individual. This reducing the probability of positive social interaction as a consequence, and this is a decline in cognitive stimulation. It is speculated that this can be due to frustrations and lacking the ability to communicate their thoughts, feelings, and needs verbally. Music is effective in reducing agitation in an individual with Alzheimer's disease. In a meta-analysis of 12 studies, on average, 60% of Alzheimer's disease patients had a reduction in agitation behaviors, proving that music is an effective therapy.
Music is an excellent tool to use in your speech therapy session, whether you administer the music in part of it or you collaborate with a music therapist. So what you can incorporate is some instruments. You can incorporate, maybe not an instrument like this, but something a little bit more portable and a little bit easier to use, you can use hand instruments. You can use a tambourine. This particular one you can actually put on your shoe and tap with your foot. You can use hand bongos. And if you really want to use an instrument or play, you can use an ukulele, which is popular because it's also very portable. Or you can sing in any of your sessions.
Not comfortable playing an instrument or don't consider yourself a singer? Another option is to collaborate with a music therapist as part of your session and in your interdisciplinary team. Here's why and how you as an SLP or SLP student can collaborate with a music therapist. Both of you are addressing the same goals, which would be assessing social functioning or pragmatics, communication, and cognitive skills. And we both promote effective, expressive, and receptive skills and language concepts, as well as oral motor skills, breath control, and using targeted phonemes and blends. Research has found that music technique promotes breath and muscle control, Peters 2000, Cohen 1994, stimulates vocalization, Strom 1989, and improved articulation skills, Zoller 1991. Incorporating music or collaborating will benefit both you and the music therapist. This will benefit the client's well-being or quality of life. It's cost-effective, and music and language share many similarities, as seen in the neuroanatomical slide done before, so the therapy will naturally complement each other. The similarities and common goals will help address the needs of the client and what music interventions to use. And music therapists can give help and direction for sessions such as singing, instrument play, and movement to music. Understanding each other's scope of practice is very important when working with another therapist outside of speech-language pathology. As such, music therapists should look at ASHA's scope of practice, and SLPs should look into the CBMT scope of practice in order to avoid conflict, any confusion, or misunderstandings. Here are some helpful ideas and tips to make music impactful in your session. You can use melodic intonation therapy. Although mainly used for stroke patients with aphasia, some Alzheimer's disease patients are aphasic, and this treatment is both familiar to SLPs and it's still musical. And play familiar music. This will help with episodic memory as well as decrease disorientation. Use either passive musical elements like listening or active musical activities like movement and playing or singing. Reach out to a music therapist for help and collaboration. And finally, have fun and repeat. Get your patients and their caregivers involved.